what kind of food do you give your baby to eat?
The first thing we do, we breastfeed our baby for 6 months.
It's only breast and water.
Is there anything that you need to do for your baby to make sure that your baby is okay, your baby stays alive?
You sleep under the net to protect the baby from malaria. You make sure that the baby is okay. If the baby is having any feeling, you take the baby to the hospital.
We used to go clinic.
Clinic.
Yes. And you protect the baby's food, the water the baby drinks, the clothes the baby wears, the bed the baby sleeps, everything that baby is doing. Make sure you wash your baby.
Okay, so what do they do for your baby in the clinic?
We take immunization.
When you put your baby to sleep, how do you do it?
You lie the baby at the back. Okay. Then when the baby started growing, you turn it back. Maybe the baby can turn on its own, but not, you can even lie the baby through the tummy to make sure that the tummy is okay.
Number one.
Oh, Efumbo, Dr. Dosekun.
Yes.
Women and grandmothers have cared for babies for hundreds of years. Why do we need to teach them? Why do we need to teach them how to do it?
I think in particular in Nigeria, because of our very poor statistics in the area of a tiny baby that has been born, particularly on the first day of life, it is on record now that roughly 1 in every 20 newborn baby dies. I think already within our culture, there's the expectation, there's the knowledge that that's a very vulnerable time. That's quite a difficult time in the life of a child. And there's a high possibility that things may go wrong. So what do you do when you're dealing with a risky situation? You prepare. You make sure you cross all the T's, you dot all the I's, so nothing goes wrong. So it's very important not to assume that the grannies or the young mothers know exactly what to do. We must have a system in Nigeria where we educate and we support mothers who are pregnant and also give a lot of support when the babies are born, particularly when we have that knowledge that 50% of babies are born at home, either with the grannies or with traditional birth attendants or a retired nurse. So there must be full knowledge. We can't leave this knowledge only within the setting of our healthcare system. It must go down to community and household practices. So everybody must know the right thing to do and the wrong things that they must not do.
What do we need to tell her? Let's start with the minute the baby is born. Yeah. What should they do?
As soon as the baby is born, the most important thing is getting that baby to have contact with the mother's skin. Of course, there's still some blood flow going on within the mother and the baby through the umbilical cord. So you allow for a few minutes for there to be like a little increase amount of blood that goes into the baby. And then the caretaker, or whoever is in charge of that delivery, will get into a position to cut the cord. Meanwhile, the baby is already having skin-to-skin contact with the mother. Cutting that cord is a very important step, and we must never take it as a light, I would say, task. Because two things can go wrong. If you don't tie two sides properly, you must tie the two sides of that cord properly, and it's in the center you do the snip. Because if you don't tie properly, you can just suddenly have loss of blood from the baby. That's right. So whoever is going to look after that baby must be skilled, and it's every mother's responsibility to go through the different steps.
So what should they do now about the cord after it's been cut? How do they care for the cord in the ensuing days?
Yes, in the ensuing days, caring for the cord means you clean the cord and you also apply an antiseptic to the cord called chlorhexidine. It is recommended that that is all we should apply to the cord and try and make it as dry as possible. That means if you're wearing a nappy or disposable nappy, it must always be below the levels of the cord so that it doesn't become soggy, so that the whole process of, I'll call it like desiccation, so that it could get very dry and wouldn't be like a good medium for bacteria to settle in. So cord care is very important. And one thing we must advise is don't add any funny thing to the cord. Because there are quite a lot of ointments, that have been prepared, particularly, in a traditional way, which is not that people actually go out and put cow dung or things like that onto these ointments, but they could be a cross-contamination. And tetanus is still a problem in Nigeria.
Yes.
And they have found that tetanus in the baby, the way it gets into the baby is through poultices that are applied onto the cord, or through infected blades, or that have gotten contaminated. So if you're going to use anything, it must be a clean, possibly even sterilized blade to cut the cord, and we should make sure we don't add any poultices. Just add chlorhexidine.
And what sort of things, since you're talking about that, because I know babies, even though they're children,
Yes.
they deal with infection very differently from
Yes.
even a 1 or a 2-year-old.
Yes.
So it's not the usual sign. So what sort of things do you watch out for in a baby that would be a clue that there's something wrong with the baby?
A baby that cries incessantly, that is always crying and really looking very distressed when they cry. I know there are simple things that make babies cry, but when the baby's crying is prolonged, and the baby is not settling down, the baby is not sleeping, the baby isn't having wet nappies, you must have at least 4 wet nappies every day. The baby may be warm, and I think though a thermometer may cost, 700, 1,000, I think it's a worthwhile investment. Yeah. Spend a little less on the ceremony. And let's get this. Yes.
I like that.
And
spend less on the ceremony.
A little less on the ceremony.
Spend less on the ceremony and
and
more
let's
on taking
invest.
care of your baby.
So I think every mother should go to a health center or a chemist and get a thermometer. So if you're worried, you can measure your baby's temperature. Anything more than 36.4, should start getting you towards a health facility. Don't sit on these babies, because babies change. A sign or a symptom of illness can start in the morning, and by the evening the baby is dead.
Yes.
So any little symptom, the baby is crying continuously, the baby isn't feeding well, the baby's nappies are not dry, the baby has spots on his body or blood splashes, the baby has a swelling in the central part of the soft part of your skull. If your baby is having twitchy movements, anything that gets a baby's vomiting, if the stool is excessively watery, normally, a baby who is breastfed would have runny stools,
Yes.
but it's not the type that would seep out of the nappy. And the frequency, sometimes you can get it up to 8 times, but those 8 stools are contained within the nappy.
Yes.
If you're worried and you're having profuse diarrhea, or the baby is vomiting, or the baby's abdomen is swollen, you should start panicking and you should get to the doctors. And apart from these symptoms, the mothers have to be detectives themselves, because we're talking about things that
Because
they
the
can
baby can't
complain
tell
about.
you
They
anything.
actually have to be a bit more of a detective with a baby than with an older child. Like if you see that the umbilical stump, if it's smelly, if you see it's a bit red, you must worry about that. You must be able to open the eyes and look for jaundice.
Yes.
Because many babies, because of all the events that happened when the baby was coming down the mother's canal, the face can be quite squashed and puffy.
Yes.
And their eyes are shut. And the parents aren't able to even detect that there's
baby is
jaundice.
with the yellowness of
So
the
you
whites,
must be
yes.
proactive. That's why in those days when, the care was mainly in the hands of the grandmothers, you would see the grandmothers during the bathing session. They
Yes.
almost do like an inspection
Yes.
of all the parts of the baby. I mean, some grandmothers overdid things where they stretched
Stretch the baby
the
and
limbs
throw the
and,
baby around.
you know, and
Yes.
sometimes to pull the limbs out, or you
Yes.
know, or they would use hot water to ferment the umbilical stump, you know, and that will create burns on the skin.
Yes.
So, I mean, some things were overdone. But even within our traditional culture, there is the awareness of the vulnerability.
Yes.
And I just want to advise every mother that has a baby. I normally give a prescription in my hospital. I said, sing 10 times a day. Because there's something called communicative musicability. It has been discovered that the more we communicate with our babies, the more the brain develops.
Absolutely.
And these children who are nurtured within this environment feel very comfortable, and they grow up to have accelerated milestones. They grow up not to be aggressive, because the emotional channels that has developed the ego of that baby and that child
in that
has been well
position.
entrenched with that
That's
process.
great. That's
So
great.
please, every mother with a newborn baby, I prescribe again, sing 10 times a day.
Let's talk a bit about breastfeeding and the importance of breastfeeding in the newborn.
I cannot emphasize it, you know, enough. You know, they say Nigerians are very religious people. And I think why is because they feel Nigerians believe there's an almighty. When you're a scientist and you learn about breast milk, if you didn't believe before, you really will believe. Because breast milk has everything that is right for a human baby. It has been made in such a way, it's phased. The breast milk that comes in the first few days is even more special than the breast milk that comes later. The breast milk that comes in the first few days, apart from giving the best nutrients in the best form that will be absorbed, is also giving the babies antibodies, is giving the baby some immune factors that is going to build your immune system so that this vulnerable baby, when attacked by bugs in the community, can fight appropriately. So can you understand the disservice that is happening now when a baby is given cow's milk, especially before 6 months?
Yes.
So this advice that has come out from intelligentsia, that try to give breast milk exclusively. The uptake in Nigeria, the figure is woeful.
It is. It's really
Considering the fact that we have so many problems within our health system, within our infrastructure, within the environment, we need to, this is one up that we can make sure.
bad. And it's inexpensive.
Yes, there has to be at least a 95% uptake. And everybody has to work on it. Not only the health policy makers, the health planners, the religious organizations we have. Because the communities, the traditional communities we have, the health settings, there must be an emphasis. But we must explain to them why.
Yes.
They must know that breast milk has everything special for your baby. The process of breastfeeding helps in that process of attachment that I spoke about, where you are already creating a beautiful emotional channel
Yes.
with your baby. It helps in making the mother's uterus contract.
Yes, yes,
It is a form of natural contraception.
yes.
Papa God has thought about everything.
Yes.
He's given us breast milk, so use it. I just want to interject and add that there's been something that has crept a long time, is adding water. There is no need to give our babies additional water. Breast milk will produce everything.
Yes.
And please do not throw away that yellow breast milk that comes in the first few days of life. This is magic. Do you know, Toju, that in some centers in America now, colostrum,
Yes.
this gold milk I'm talking about, is being collected now and is being prepared for even non-babies because of all the goodness in it.
Yes, yes.
That's one point. Another point I have to emphasize is the preparation. You have to prepare so that you don't feel you're a failure, because that can lead to a lot of frustration and depression for our new mothers.
If they're unable
So
to
in
breastfeed
in the antenatal period, particularly in the last month, there must be a lot of preparation to make sure that your nipple is in a good condition. When the baby is born, you take adequate amounts of fluids and you eat well. I just want to make one statement. I want to remind everybody, as the mothers, the grannies, the health planners, the government, that 1.16 million newborn babies die every year in Africa.
Yes.
It is an unacceptable number, and we all have to join hands and make a change.